Hi, welcome to Point Categories, presented by Lamp AccuWellness Foundation, Inc., featuring Luo-connecting collateral points, Part 2, the individual Luo points. While the body has innumerable small collaterals, there are certain points along the channels that are more directly associated with the larger branch collaterals, thought to facilitate interconnection between yin and yang channels. By this, we don't mean to suggest thick or substantial collateral pathways going between lung 7 and the large intestine channel, for example. Rather, the collaterals are small vessels branching out from the major channels from the area around the collateral points out to the level of microcirculation, where they meet the microcirculation of their paired channel. The collateral points are areas along the channels where one can induce a fairly quick and dramatic effect on this interplay of yin and yang. By using the collateral points to affect paired channels, the result is a kind of regulation of yin and yang, a balancing between the often contrasting functions of the two paired organs. For example, consider the use of a stomach channel point like stomach 40, Feng Lung, as a collateral point to affect the interior-exterior paired spleen channel. Modern functions for this point most often describe transformation of phlegm and stagnant fluids. To be precise, the effects of the point draw from its ability to balance the yin and yang natures of the spleen and stomach organs. In this case, the spleen organ has become encumbered by phlegm, excessive yin, and thus needs a boost of yang movement from the stomach. The collateral point is a place from which this goal can be pursued rather quickly. Another way to describe the function of the collateral points might therefore be to say that they are balancing excess and deficiency. If pressure is high in the yin channel, then the collateral point of the yang channel might be used to reduce the excess. If there is low pressure in the yang channel, the collateral point or the yin channel might facilitate a filling in of the deficiency. To restate, collateral circulation is by no means limited to the connection of interior-exterior paired channels. The concept also represents microcirculation of small vessels along the paths of the associated channels. Taking both of these concepts into account, one might identify two major uses of the collateral points. Treat interior-exterior paired channel disease. This use of the collateral points involves the use of yin-channel collateral points to treat yang-channel conditions and vice versa. The Guide to the Classic of Acupuncture states, the Luo-connecting points are located between two channels. If they are punctured, symptoms of the exteriorly-interiorly related channels can be treated. In clinical practice, many of these points are used to treat disorders of both their corresponding zangfu and channel, as well as their interiorly-exteriorly related zangfu or channel. For example, Lie Che Lung 7 is an important point in the treatment of headache, pain of the neck and nape, wind disorders which affect the head despite the fact that the lung channel does not ascend higher than the throat. And these indications are explained by the pathway of its interiorly-exteriorly related large intestine channel. Pian Li, large intestine 6, is used in the treatment of acute edema, which occurs when external wind disrupts the function of the lung in regulating the water passages. Feng Lung, stomach 40, is an essential point to assist the transformation of phlegm, which accumulates when the spleen's transportation and transformation function is impaired. Kung Sun, spleen 4, is able to harmonize the function of the stomach and intestines, which are governed by the spleen, and to treat both upper, the stomach, and lower spleen, abdominal pain. Ji Chung, small intestine 7, has a pronounced effect on regulating and calming the heart spirit and is indicated for a wide range of psycho-emotional disorders. Fei Yan, bladder 58, is able to treat kidney deficiency and cold in the lower part of the body, like coldness and weakness of the legs, lumbar pain, as well as uprising of yang along the bladder channel to the head, headache, dizziness, and heat. Nei Quan, pericardium 6, is universally known for its ability to treat nausea and vomiting. Both the pericardium channel and its interiorly-exteriorly related Sanjiao channel descend through the upper, middle, and lower jaw, reinforcing the ability of Nei Guan pericardium 6 to treat disorders of the middle jaw. Kuang Ming, gallbladder 37, is much used in the treatment of eye disorders due to disharmony of the liver. Treat collateral disease. Here, the collateral point is used to affect microcirculation along the pathway of the selected channel. For example, one might use Li6, Pian Li, in the treatment of chronic facial paralysis when one suspects that the ability of the channel to bring nourishing qi and blood into the collaterals on the face has been affected. This concept has very broad clinical application. Luo-connecting, lung 7. The lung Luo-connecting channel spreads through the thinner eminence, and Luo-connecting, lung 7 is an important point in the treatment of thumb disorders. Pian Li, large intestine 6. The large intestine Luo-connecting channel ascends to the ears, and Pian Li, large intestine 6, is especially applicable in the treatment of ear disorders such as tinnitus and deafness. Feng Long, stomach 40. The stomach Luo-connecting channel terminates at the throat, and Feng Long, stomach 40, is indicated for swelling and pain of the throat, throat painful obstruction with sudden loss of voice, and plum stone throat. Kung Sun, spleen 4. The spleen Luo-connecting channel enters the abdomen and connects with the intestines and stomach, reinforcing the ability of Kung Sun, spleen 4, to treat pain and disharmony in both these areas. Tong Li, heart 5. The heart Luo-connecting channel ascends to the root of the tongue, and Tong Li, heart 5, is much used clinically to treat stiffness of the tongue and speech impairment, especially following wind stroke. Da Chung, kidney 4. The kidney Luo-connecting channel ascends to a point below the pericardium, and Da Chung, kidney 4, is indicated in the treatment of palpitations, restlessness, and agitation of the heart with fullness and vomiting. Li Kao, liver 5. The liver Luo-connecting channel ascends to the genitals, and Li Kao, liver 5, is the primary point on the channel to treat a wide variety of disorders affecting this region. Whilst it is true that classical texts include a variety of psycho-emotional indications for many of the acupuncture points, several of the Luo-connecting points are particularly important in this respect. For example, Lie Che, lung 7, poor memory, propensity to laughter. Feng Long, stomach 40, mania, depression, mad laughter, great happiness, desires to ascend to high places and sing, discards clothing, and runs around seeing ghosts. Kung Sun, spleen 4, mania, depression, disorder, manic raving, insomnia and restlessness, gallbladder deficiency, much sighing. Tong Li, heart 5, frequent yawning and groaning with sadness, vexation and anger, sadness and fright, frequent agitation with burning sensation of the heart, depressive disorder. Qi Chong, small intestine 7, mania, depression, fear and fright, sadness and anxiety, restless sang disorder. Ta Chung, kidney 4, palpitations, restlessness, dementia, mental retardation, somnolence, propensity to anger, fright, fear, and unhappiness, desire to close the door and remain at home. Nei Quan, pericardium 6, insomnia, the 5 types of epilepsy, mania, poor memory, apprehensiveness, fear and fright, sadness, loss of memory following windstroke. Li Kao, liver 5, plum stone sensation in the throat, depression, fright palpitations, fear and fright, worried oppression. In addition to the Luo-connecting points of the 12 primary channels, there are 3 further Luo-connecting points. Jiao Wei, Ren 15, or CV15, is the Luo-connecting point of the conception vessel, from where the qi disperses and spreads down over the abdomen. Chang Chiang, Du 1, is the Luo-connecting point of the governing vessel, from where the qi ascends bilaterally along the sides of the spine to the nape of the neck and spreads over the occiput. At the scapular region, it connects with the bladder channel and threads through the spine. Ta Pao, spleen 21, is the great Luo-connecting point of the spleen, which emerges at 3 Tsun below the axilla, spreading in the chest and lateral costal region. Treatment techniques should reflect the fact that within the channel system, the collaterals are relatively shallow. When stimulating any of these points, whether to treat interior-exterior paired channel disease or collateral disease, the depth of insertion should accordingly be shallow. In addition, the best manual technique for these points involves either very low intensity lifting and thrusting or rapid twirling. Long 7. Luo-connecting. Traditional considerations of the channel collaterals involve the division of symptom patterns into categories of excess and deficiency. For example, on the long tie-in channel, excess in the collaterals involves redness, heat, and inflammation on the forearm. Deficiency includes both frequent yawning and frequent urination. In the discussion that follows, the traditional symptoms of excess and deficiency will be mentioned only in cases where our clinical experience in using the point can be illuminated by these concepts. This is not meant to suggest that the traditional collateral vessel patterns should be ignored. The collaterals of the lung channel service the throat and upper respiratory tract, and lung 7 is appropriate for many conditions involving this area. When the point is stimulated at a very shallow depth of 0.1 to 0.2 inch, it is effective for treating throat discomfort and cough. Needling at this shallow depth is also appropriate for treating a narrowing or blockage in the upper respiratory tract or spasms in the smooth muscles of the throat that has led to difficult or shallow breathing. When needled slightly more deeply, the point is more effective for treating headaches, often those involving external patterns. Finally, at the deepest level, approaching the bone, the point is sometimes used for problems with the cervical vertebrae. Lung 7 is also used to release the exterior in cases of external invasion and cough. This function of the point and its traditional use for treating urinary problems are not unrelated. Recalling that tie-in opens to the external aspect of the internal environment, one can imagine how the collaterals of tie-in reach up to the border of the skin. By facilitating circulation at these outward opening collaterals, one can resolve problems affecting the surface. Similarly, the Tai-Yang channel opens to the external aspect of the external environment. Because both channels have an outward opening movement, their functions can overlap. The sweating of the skin and the passage of urine are both means of releasing fluids and waste. When there are problems releasing upward due to dysfunction of the tie-in collaterals, the symptom of frequent urination might arise. In the clinic, not only frequent urination, but other types of urinary problems where the lung is also involved respond to treatment with this point. Because of the interior-exterior pairing of the lung, large intestine, the point can also be used to unblock collateral circulation on the large intestine channel, on the face, in cases of facial paralysis from stroke, Bell's palsy, and trigeminal neuralgia. Finally, the point is used in those cases of high blood pressure where lung function is also compromised, or palpation reveals significant changes along the lung channel. Large intestine 6, Pian Li. In general, the effects of this point are in the upper aspect of the body. Deficiency of the large intestine collaterals is most commonly associated with tooth pain, including sensitivity to cold. Deficiency in the Yang Ming collaterals might also involve discomfort in the chest or an uncomfortable feeling in the esophagus. Li6 is often used to clear heat from the Yang Ming collaterals. This includes symptoms such as frequent nosebleeds, red eyes, toothache, tinnitus, swelling in the throat, and or face or facial paralysis. In fact, Li6 is one of the most common points used for trigeminal neuralgia, or facial paralysis. In addition, when there is heat trapped in the yang-ming collaterals, the ability of Tai-yang to open outward might be compromised, leading to a lack of warmth on the exterior. The net result of this pathodynamic might involve a tendency to be easily affected by exterior invasion or, alternatively, difficult urination. Stomach 40, Feng Long. Stomach 40 is indicated for a variety of conditions involving dampness and the accumulation of phlegm. This draws from the ability of the point to provide a yin-yang balance with the functions of the paired tie-in spleen channel. It is important to remember that the type of phlegm and damp conditions that respond best to treatment with stomach 40 involve excess type accumulation that is encumbering the spleen. In these cases, the spleen is overwhelmed and requires stimulus from the yang of the stomach channel. In addition, stomach 40 is also an excellent point for treating yang-ming channel type facial problems. When there is heat in the face, there will occasionally be more pronounced palpable change at stomach 40 than one might find at LI6. In these cases, stomach 40 is more appropriate. Spleen 4, Kung Sun. Not only is spleen 4 the collateral point of the spleen, it is also the command point of the Chung vessel. The functions of the point thus reflect not only the spleen stomach, but also the strong blood flow of the Chung. This point is used to regulate the spleen stomach in a wide variety of conditions, which, like those associated with the collateral point of the stomach, also often involve pathogenic dampness. The collaterals of the spleen are associated with the face, in particular the area around the eyes. Swelling around the eyes is therefore often thought to reflect an accumulation of dampness in the collaterals of the spleen. The collaterals also travel through the chest, and in some cases, where there is also tenderness in the area, spleen 4 can be used in the treatment of pleuritis. Because the Chung vessel brings a strong flow of blood to the organs of the abdomen, spleen 4 is also often used for digestive problems involving deficiency. Symptoms may include an inability to digest food and abdominal distension. These conditions may be due to a lack of proper acid production in the stomach. In addition, because of the relationship of the Chung vessel to blood, this point is often used in the treatment of irregular menstruation and pelvic inflammatory disease. On the other hand, spleen 4 also has an ability to clear the collaterals of the paired yang-ming stomach channel. In these cases, it is actually used to clear heat. Symptoms of this type of yang-ming heat may include nausea, vomiting, stomach pain, insomnia, and irritability. Note that in such cases, the trapped yang-ming heat is moving upward to affect the heart. Heart 5, Tong Li. The collateral vessels of the heart are described in the inner classic as traveling to the root of the tongue and then upward to the brain and back of the eyes. Heart 5 is used in the treatment of a wide variety of conditions affecting the tongue, speech, and brain. When there is excess accumulation in the collateral vessels of the heart, a sensation of distension in the chest may arise. Deficiency in these collaterals is traditionally associated with speech problems. The types of speech problems associated with the heart collaterals involve a slowed rate of speech, low speech volume, or an unwillingness to speak at all. In all cases, there is also a sense of compromised clarity of mind in which ideas and concepts are often not clearly described. The very useful point has four main clinical applications. Unblocking the collaterals of the heart. Heart 5 is used to regulate the beating of the heart, electrical conduction system of the heart, and to treat chest pain. Unblocking the collaterals of the tongue. This function encompasses treatment of a wide variety of problems involving movement of the tongue, including acute paralysis of the tongue, sudden loss of speech due to severe emotional stress, or even chronic tongue sores. Unblocking the collaterals of the brain. This very common use of Heart 5 involves the treatment of patients who have had a stroke. Because the heart collaterals travel through the brain, this point is often a lead point in the treatment of many types of post-stroke sequelae. Clearing heart fire. Heart 5 does not clear heart fire directly, but it does effectively clear the fire by unblocking microcirculation. It can be useful for heavy menstruation and other types of heat and inflammation in the uterus, especially when the symptom pattern also involves the heart. This should be contrasted with other types of heat in the uterus. For example, it was noted earlier that spleen 4 can be used for inflammation in the abdomen, including uterine inflammation, when there is a damp heat pattern involving the spleen. Heart 5 is more appropriate for inflammation involving heat and toxins in the blood. Small intestine 7, junction. This point is traditionally said to unblock the collaterals and transform stasis. SI7 is also described as having the ability to generate in fluids. The chi dynamic of the small intestine is often associated with the generation of these thicker, more viscous fluids in the body. This point has been clinically useful in the treatment of headaches, dizziness, stiff neck, styes, or other small growths in and around the eyes, often related to liver fire. For dizziness, it is appropriate in cases where an external hot type pathodynamic has led to fever and a rush of blood to the head. Bladder 58, Fei Yang. This point has an ability to unblock the collaterals and awaken the brain. It is therefore useful in the treatment of headaches, dizziness, nosebleeds, and nasal congestion due to external invasion. Bladder 58 also facilitates nourishment of the sinews by stimulating the movement of moistening yang fluids. This would make the point an appropriate choice in the treatment of low back, thigh, and leg conditions involving spasms or a lack of moistening of the sinews. The point is also often used in the treatment of hemorrhoids and cystitis. Kidney 4, Ta Chung. This point unblocks the collaterals, calms the spirit, and clears Taiyang heat. When using the point, the two collateral pathways leading from kidney 4 should be considered. The first travels upward to the tongue and then connects with the bladder channel. The second collateral travels shallow to the regular kidney channel, up through the kidney and pericardium organs, then around the chest to the spine and back. Kidney 4 is therefore often considered in the treatment of lumbar pain when there is concurrent irritability and/or a stifling sensation in the chest. This condition is said to arise from deficiency in the kidney collaterals. By contrast, excess in the kidney collaterals is associated with combined constipation and difficult urination. Because of its collateral pathway connections, this point is also helpful in the treatment of dry mouth, mouth ulcers, difficult urination, and irregular menstruation. And because of the effects of this point on the spirit, kidney 4 is also helpful in the treatment of panic, slow development in children, or dementia in the elderly. When needling the point, the sensation will rarely travel up or down the channel. Instead, the goal should be to achieve an aching sensation that radiates in all directions from the point. Pericardium 6, Nei Quan. The point is associated with the yin wave vessel. The clinical uses of pericardium 6 are broad. In general, the point has three functions: to regulate the qi, calm the spirit, and harmonize the stomach by directing counterflow downward. The ability of the point to regulate the qi is helpful in cases where there is pain in the internal organs due to deficiency or qi constraint, a mechanism that is also at work when one uses the point to harmonize the stomach in cases of gastritis or stomach spasms. The ability of the point to harmonize the stomach makes it a favorite in many point prescriptions for nausea as well. Besides the stomach, however, the point is often used for angina, carditis, pleuritis, and intercostal neuralgia. The effects of the point on the spirit are most pronounced in cases of constraint or depression. These patterns may be combined with the irregular heartbeat or other symptoms due to lack of in-nourishment to the heart organ. When considering pericardium 6 in the context of the pathway of the pericardium collaterals, it is sometimes helpful to remember that deficiency in the collaterals is associated with weakness or numbness of the elbow, while collateral excess is associated with spasms of the elbow or surrounding muscles. These are conditions for which PC6 is less often considered, but may nonetheless be beneficial. Triple burner 5 or Sanjiao 5. Why Guan? This point has the ability to unblock the collaterals, clear heat, and resolve toxicity. In particular, the point is used to unblock the more superficial floating collaterals to vent heat from the body. Like PC6, lung 7, and spleen 4, Sanjiao 5 is another collateral point that is also a command point of the extraordinary vessels. All of the collateral points that also relate to the extraordinary vessels have broader uses than their regular channel association might suggest. In this case, the relationship with the yang wave vessel means that Sanjiao 5 is often used to benefit circulation of yang to areas beyond the pathways of the regular channels. This concept would explain the mechanism through which Sanjiao 5 is able to vent heat from the body. By linking the yang circulation in multiple yang channels, the point has a decidedly upward and outward directed function. This upward and outward motion also allows the point to promote movement of qi and to open the orifices in cases of external invasion of either a warm or cold nature. Symptoms may include fever, cough, headache, or even bronchitis. Heat trapped in the body may lead to red painful eyes or conjunctiva, tinnitus, insomnia, or high blood pressure. Finally, conditions associated with triple burner dysfunction affecting the digestive system, such as diarrhea, abdominal pain, or constipation, may also be treated with Sanjiao 5. Gallbladder 37, Guangming. The Chinese name for this point, Guangming, literally means light or brightness, and is a hint to the point's particular affinity for the eyes. As other texts often point out, it is used clinically for a wide variety of eye disorders. GB37 is used to slow the process of cataract development. It can be helpful in less severe cases. It is most effective, however, in cases where the eyes are affected by heat coming from the liver gallbladder, which involve redness, itching, or swelling. Chronic allergies or conjunctivitis are particularly responsive. Liver 5, Li Kong. The collateral point of the liver is used primarily to regulate the circulation of qi and blood. The liver organ is charged with maintaining the pathways and supply of qi and blood throughout the body, and it is from the collaterals of Zhiyin that circulation reaches out. The collaterals of the liver channel are especially related to the lower abdomen and genitals. Consequently, liver 5 is often used in the treatment of excess-type menstrual disorders, frequently involving stasis of qi. In addition, the point is used in many classical prescriptions for a variety of problems in the groin and genitals, including herpes zoster, testicular pain, uterine inflammation, and leukorrhea. In addition, because of the commonly seen relationship of the musculature of the groin to low back pain, this point can be helpful in treating lumbar pain, especially when there is also tenderness at the point. Because the pathway of the Zhiyin pericardium passes through the forearm and wrist, there will also often be tenderness in this area in cases of carpal tunnel syndrome. In such cases, liver 5 can be an effective distal point. CV15 or REN15, Jiu Wei. Many sources list this point as contraindicated for needling. In fact, it can be safely needled at a shallow depth, 0.5 to 1 inch, if the patient raises his hands above the head. Nevertheless, because of the presence of the heart organ nearby, care should be taken and the technique should be gentle and slow. This collateral point of the Ren vessel is used to transform blood stasis, especially in the pericardium, transform phlegm, and redirect counterflow downward to benefit the stomach. For transforming blood stasis, the point is used when stasis leads to symptoms such as angina or intercostal neuralgia. The ability of the point to transform phlegm can be brought to bear by using moxa. This technique is utilized in cases of pericarditis, childhood epilepsy, and heart-type mania. For chronic belching and asthma, the point is used to direct qi downward. GV1 or Do1, Chang Chiang. For those familiar with yoga positions, this point is best needled in the crouching child's pose position. Knees bent, head down, hips up. In this position, the point can often be needled without requiring the patient to completely remove his undergarments. The point is generally needled to a depth of 1 to 1.5 inches until a deep radiating sensation is achieved, which may radiate to the back. GV1 can also unblock the collaterals to resolve dampness and clear heat to resolve toxins. The point is clinically effective for removing damp heat accumulations that affect the genitals, including itchy, painful sores or herpetic outbreaks. It is also used for treating hemorrhoids, pain of the sacrum, and prolapse of the anus. Thank you very much for your attention, and see you in our next videos.